All right, hi everyone. Happy Monday. It's Monday, July 20th. My name is Rendi Murphree. I'm an epidemiologist and the Director of Disease Surveillance here at the Mobile County Health Department, here to give you our Facebook Live update on the impact of COVID-19 pandemic on Mobile County. So we'll start with the worldwide numbers since this is the kickoff for our new week. Worldwide, there have been over 14,500,000 cases of COVID-19 with around 607,000 deaths. In the U.S., almost 3.8 million cases of COVID-19 with just over 140,000 deaths. And in Alabama this morning, they're reporting 67,711 cases with 1,257 deaths. So in our daily report today, we're reporting on 6,207 cases of COVID-19. That was an increase of 119 on yesterday, Sunday the 19th. We had quite a bit of activity over the weekend. So since we spoke on Friday, 167 cases were reported on Friday, 152 on Saturday, and 119 on Sunday yesterday. We have added the number of deaths back to our daily report after learning that the systems that are in place are still a little behind, but they are in place to continue recording the number of deaths in our standard surveillance system that the Department of Public Health runs, called ALNBS. We are still working on the report of the number hospitalized, so be a little bit more patient with us on that. On today's report, again, you can see that around 2,766 have presumed recovered. In the week ending Saturday, for the week, we reported 1,135 cases. That was up from 823 the week before. And again, nearly a tripling of the number of cases added each week compared to just about a month ago. So we are seeing very high numbers reported daily, and we continue to see most of this occurring in younger age groups. I think someone asked me last week about looking at the age groups at some smaller age categories, so I did that. So this is not something that we'll start publishing publicly, but you can see this largest number of cases is in this 20 to 30% category, 20 to 30 years old category. But if we look at the percents, not just the numbers, the highest, the category with the highest percent of cases is in that 20 to 30, followed by 30 to 40, and then 40 to 50 and 50 to 60. So 22% of all of our cases are in the age group of 20 to 30 years old, and just over 15% is in the age group 30 to 40 years old. We still are seeing mostly women, about 40, sorry, I lost my place here, 41% among African Americans, 24% white, and a few in other race categories. We kept the chart in here this week that shows the number of cases by week by age category, so that you can see how that number is really growing in those green categories. The average number of cases reported has gone up to nearly, over 150 for the 7-day moving average, and around 130 for the 14-day moving average. Again, this is the chart that helps to smooth out the effect of a Saturday and Sunday, usually a drop in the number of people who are tested for COVID or the results that are processed for COVID. They tend to be lower in the beginning of the week. And then if we look at the percent positive of our test results, last week, around 20% of all tests conducted on Mobile County residents were positive for COVID. This again is extremely high, but consistent the last couple of weeks, where we've had between 20 and 22% of all of our laboratory results being positive. We added the table back today talking about, or this weekend, sorry, talking about the characteristics of the number of people who've been hospitalized or have died. Again, the number hospitalized in the ALNBS is a gross underestimation of how many people are actually hospitalized, and it only includes data on Mobile County residents. There have been really no significant shifts in the trends of among patients who have been hospitalized or have died. If you are paying close attention, you will see a new number in our weekly expanded report. I am just awash in paperwork today, my apologies. So on the weekly expanded report, the one that I run on Sundays and that then we then send out on Monday, this statement is here that 1,005 COVID patients have been hospitalized in Mobile County by July 17th. So this comes from the Ames data. This is, ADPH has been reporting this on their website, and we are beginning to do the same. It's just taken us a little time to get our processes in order. So 1,005 COVID patients. This includes the cumulative total number of admissions and discharges, which was 840, plus the number of admitted patients with confirmed COVID on July 17th, which was 165. So you add those numbers together, and it's 1,005 COVID patients hospitalized through July 17th. And again, these data are reported by hospitals to the Alabama Incident Management System in aggregate. There is some individual level information, but not much. And the number includes residents or patients who are in Mobile hospitals but don't reside in Mobile County. So they live in other jurisdictions or in other states. So that number is quite a bit higher than the number of hospitalizations that we report on out of ALNBS, which includes only Mobile residents. So that's one explanation for the big difference. The other is just that, as we have continued to say, that the number of lab results being reported to us has dramatically increased by almost three times the number of cases that we were seeing just a couple of weeks ago, and it will take us some time to catch up on those investigations. So let me then see, don't forget to look at the map. This is just the cases over the last 2 weeks so that you can tell how severe things might be in your zip code, your resident zip code. And then let me just comment on a couple of other important changes. On Friday and into Saturday, the Centers for Disease Control made some important updates to their guidelines for quarantine and isolation for cases and contacts. And I want to talk about this because it impacts everyone. And you know, when these decisions are made and announced, behind the scenes there have been a lot of scientists and physicians and epidemiologists, data analysts looking at the evidence behind the policies and the procedures that are recommended, and some, you know, a deeper dive on some of those things and the things that we're learning about the pandemic, about the virus as we move along, have resulted in a change in recommendations. So for quarantine, for anyone who has been around a COVID positive patient, whether they were symptomatic or not, if you have been around someone who tested positive for COVID or had symptoms for COVID, you are required to quarantine at home for 14 days. End of story. 14 days for all contacts. That has not changed since the beginning, but I don't remember exactly, but I think that has been the same. So for a contact, someone who's been around for 15 minutes or more, within 6 feet or more, someone who's been laboratory diagnosed as having COVID or who had COVID, regardless of whether you're wearing a mask or not, you must quarantine for 14 days. CDC is now walking away from the use of 2 negative tests, so moving away from the test-based method for discontinuing quarantine for 14 days. So there is no need for people to go out and try to get tested if they're quarantine to return to work or to return to school. None of that is, we're not recommending that being done anymore. There was a time where our capacity was such that we might be able to do that. The science was uncertain enough, maybe that we thought that was important to do, but that's no longer the case. So stay at home for 14 days, do not get tested, and stay at home until you ride out that 14 days of quarantine. For COVID positive patients, so if you're symptomatic and you test positive, or if you test positive and you're asymptomatic, the period of time that you must isolate at home is 10 days. And the last 24 hours has to be symptom free, no fever and no other symptoms, particularly no other respiratory symptoms. So you stay at home for 10 days if you are COVID positive, whether you've had symptoms or not. If you had symptoms, you stay at home for 10 days, and at least the last 24 hours have to be symptom free. And again, we're not recommending test-based strategy for discontinuing of isolation for people who are COVID positive. In fact, CDC has gone further to say if you are COVID positive, you should not get tested at all for at least 3 months past your first COVID positive test. That is a really big change. So we are not recommending test for returning to work or returning to school or getting on an airplane if you have tested COVID positive before. Because of the persistent shedding and some other things, do not get tested for at least 3 months after a first positive test. Now, I know we're going to have lots of questions about this, so I will move on from this topic, and we'll probably have some questions on that tomorrow. Someone had asked us about enforcement of the mask order. There's been lots of, I think, misunderstanding about what the city ordinance or the ordinance that the health officer issued, or the mask ordinance that was issued by the governor and the state health officer, who's responsible for enforcing that ordinance. And the answer is, it's a personal ordinance. It's up to the individuals to comply with this ordinance. So if I am not complying with that ordinance, then yes, local law enforcement could, charge me with a misdemeanor. They cannot charge businesses. They cannot charge schools. This ordinance applies to the individual. So please just remember that you cannot, your boss or your office or your business is not the one responsible for enforcing the ordinance. The law enforcement is not going to go into a business and cite a business owner for not enforcing the mask ordinance. That is on the enforcement is on the individual, not on the business owner or the school or the church. So I hope that sheds some light on that, and if we need to talk about it more, we can do that. All right, so on to some questions. The first media question was asking something about the report related to figure 2. Patients with COVID, is it hospitalized persons with COVID? The week ending June 12 had 1,130 people currently hospitalized. We might be looking at the wrong table. I might be looking at the wrong table. So I'm not quite sure what that's about. So we'll try to get that clarified from whoever was asking about that.
Was it cumulative or?
So all of the hospitalizations are cumulative. All of the reports are cumulative. The difference in the number depends on the 2 different reporting systems. So in ALNBS, which is our traditional public health surveillance system, that includes only mobile residents and data only on the people that we've been able to interview or follow up on to find out if they've been hospitalized since the first time we spoke with them. That's a little tough for us to get that done right now. The other source of hospitalization data, AIMS, is also, it contains cumulative information, but also day of information. But the number that's reported by me in the expanded report is the cumulative and the daily number when I reported this, which was yesterday. So that, yes, they're both cumulative. All right. Some questions from Facebook. Why don't positive people, why aren't they ordered to stay home? Well, they are ordered to stay home. That is the, those are the instructions that anyone who is positive, whether you're symptomatic or not, must stay home for 10 days. I think the trouble is that we have to rely on voluntary compliance with that order. But it is a health order that they are to stay home. Let's see, here's next. And the same goes with people who are exposed. So if someone in your family has COVID, you have to stay home for 14 days regardless. Okay, I'm concerned about the decision of the feds to move hospitalization data and death data away from CDC. What does this mean for us locally? Right now, things are progressing as normal locally. So our local hospitals are still reporting data into Ames, and we still have access to that information to make, to help inform decision making. So far, that has not changed. Where I have seen, not in our jurisdiction, but in other parts of the state, is that it's bringing more attention to localities that maybe have a large increase in the number of cases. So the feds are able to look at that information, and they are reaching out to jurisdictions and trying to see if they can ask questions or gather information or offer assistance in local jurisdictions. Normally, things follow a chain of command, right, from a local the local health department or a local, emergency management agency to the state, to the feds, that way. But they're sort of hitting it at all angles. So that's the kind of initial change that I've seen, is that we get more inquiries from the Department of Health and Human Services. Should the entire family quarantine if one member has COVID? Yes. So if it's doubtful that you've been able to stay 6 feet apart from all of your family members who live in the same house as you for the few days, prior to someone in your house testing positive for COVID, or at all. So yes, if someone in your household tests positive for COVID or has symptoms of COVID, then you all should stay at home. Let's see. Are there studies that show when a person contacts COVID, do they generally have similar symptoms as the person? So I think what this question is getting at is that if I catch COVID from someone who has a cough, will I have a cough? Or if I catch COVID from someone who has diarrhea, will I have diarrhea? And the answer to that is probably not. The type of symptoms that you have tends to be more decided sort of on your particular body, right? Like your immune system, somewhat how you contracted it, but it doesn't mean that if you caught it from someone who has a cough that you're going to have a cough. Let's see. Why was the length of COVID-19 exposed lower to 10 to 15 days? So this is a little bit of a mixing of effect. So the 14 days is still into effect for people who are exposed. The 10 days is for someone who's infected. And an extraordinary amount of data has been available to learn about this, right? Because we have, 3.7 million cases in the U.S. And so CDC and others have determined that 10 days is long enough so that we feel confident that COVID person is no longer spreading live virus to other people. There's one really big exception to that, and that is if you are COVID positive and you have extreme immunocompromised situation, like therapy for cancer treatment, or maybe a transplant recipient, we would extend that from 10 to 20 days. But for most people, that 10 days is a long enough window to be feel sure that you are no longer spreading live virus to other people. And there's also growing evidence that you will have some protection, at least for a few months, from that sickness, from that first infection. So you're not gonna, if you're in your household and other people start to get it, you're not gonna be reinfecting each other. It's just gonna, once you have it and you recover from it, you're not gonna pass it on, and you're likely not going to get reinfected anytime soon, as far as what we know now. So face shields safe for school kids. So we've heard this question before, that people are asking about how difficult it is for children to wear a cloth face covering, and wouldn't it just be easier to have them wear a face mask? But the problem with a face mask is it doesn't cover your respiratory droplet. So you can still, spread respiratory droplets underneath the mask. And it also, unless it's a full face mask, then you also would not be able to, it wouldn't help keep your fingers out of your face. So those couple of things. I suppose if there were a full face mask that children could tolerate more than a face covering, that would be okay. But just a partial face mask, it would be somewhat protective, but not as good as wearing a cloth face covering. All right, should someone get tested if they had signs and symptoms 2 months ago? No, you should not. How dangerous is it for a nurse carrying a COVID patient hospital coming to visit baby? So someone's asking if they're a nurse caring for COVID patients in a hospital, how dangerous would it be for that same nurse to visit children in another state sometime next month? So this is looking for somebody to ask me to help them decide if they need to cancel their travel. Everybody should cancel non-essential travel right now. It's just not a safe time to be out moving about. But if you do travel, then wear a face covering, stay 6 feet away from people in congregate settings. And again, I would not want to be that risky with moving around, particularly for healthcare workers. So I think that's where we'll stop for today, and we will be here again tomorrow to tell you what's going on in our community, to try to clarify all of the changes, or some of the changes at least, that have been announced by the Centers for Disease Control on Friday and Saturday, because it really is a lot of information that we're trying to digest and translate that to you. So we'll continue being here to answer your questions and provide our local perspective, and we'll see you tomorrow.